Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. COVID-19 Incident Manager, Edo State, highlights genomic sequencing as crucial to managing COVID-19 in Nigeria. And COVID-19 survivors join Ekiti State Ministry of Health to sensitize residents on the need for vaccination. And India's daily COVID-19 cases see a sharp 45% spike as the country's Omicron tally surges to 781. Thank you for joining us. The UN Secretary-General Antonio Guterres has urged countries to make recovery for people, planet and prosperity their resolution for 2022. Mr. Guterres, in his New Year message, said, "The world welcomes 2022 with our hopes for the future being tested by deepening poverty and worsening inequality, an unequal distribution of COVID-19 vaccines, climate commitments that fall short, and by ongoing conflict, division and misinformation." He added that these were not just policy tests, but moral and real-life tests. According to him, these are examinations that all of humanity can pass if we commit to making 2022 a year of recovery for everyone. Mr. Guterres, who detailed how best the recovery should be done on each front, said that the pandemic required a bold plan to vaccinate every person everywhere. Here's more on the pandemic update.
599 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT. That's a drop from the figures reported earlier. Delta logged the highest number of cases with 194 positive samples. Edo had 94, FCT 80, Kaduna 48, while Lagos registered 35 cases. Ondo had 23, Kano 21, Rivers and Kwara registered 20 cases each, Ogun 18, and Plateau logged 12 cases. Other states, including Abia, Cross River, Ekiti, Bauchi states logged single-digit infections. The total confirmed cases in Nigeria now stands at 239,019. The report also includes a backlog of confirmed cases from Delta State and 0 cases from Osun and Sokoto states. 410 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 213,180. There were 3 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,027. Currently, there are over 22,000 active cases in Nigeria, while over 3.8 million samples have been tested so far. More than 9.8 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4.3 million persons have been fully vaccinated. The total global confirmed cases have surpassed 282 million, while deaths are beyond 5.4 million.
The COVID-19 Incident Manager in Edo State, Dr. Andrew Obi, has highlighted the importance of genomic sequencing laboratories in the country. According to him, this is necessary to improve detection of the COVID-19 and early case management. Dr. Obi also wants persons with symptoms suggestive of COVID-19 to take the appropriate steps of getting tested and treated early, as he highlights some differences between the fourth and previous waves.
When COVID started, we didn't have so much laboratory capacity to carry out PCR tests. Then it was just 3. Had the National Reference Lab, we had EROA, and interestingly, Edo State hosted one of the 3 labs then, and there was a massive scale-up of PCR laboratories across the country. Now we have over 120 PCR laboratories across the country, cut across public and private institutions. But what I think we should be able to do now is that we should be able to strengthen our capacity for genomic sequencing. Sequencing will help you tell what strain, we're looking at the behavior. The behavior based on what we are seeing is different from Delta. But as scientists, we need to have evidence to substantiate that claim. because it could be subjective. And so the only way we can be able to do that is that if we have evidence, and genomic sequencing will provide that evidence. I believe we have the human resources for health for that. I also believe strongly that the NCDC, working with the partners and support from the federal government, can be able to strengthen that process. Maybe for a start, maybe a sequencing lab for every geopolitical zone. Then furthermore, we can now scale up that process moving forward. That will be a game changer in terms of our ability to identify cases and also to bring them into care. What we are noticing, based on the Edo State peak figures, is that over the past, for the first 2-3 weeks of the third wave and now, there seem to be more deaths in being reported now in the fourth wave over the same period compared to the third wave. But we cannot, to a large extent, say now that the severity from Omicron is more than that from Delta. So we're monitoring it closely at the state level. We are building our capacity to manage severe cases. We are ramping up our oxygen supplies. We're carrying out refresher training across pillars and across most especially case management pillar. At the facility levels, isolation facility levels, activities there are already in full swing. And so that tells you that in terms of our readiness, we are actually ready for it. We want to encourage our people. If you have symptoms suggestive of COVID, the earlier you get tested, the earlier you're placed on treatment, that to a large extent will determine the outcome.
Following the first case of COVID-19 reported in Nigeria February 2020, the NCDC has continued to lead public health response activities. And one critical priority for the response is the scale-up of access to testing. And as part of those measures, the NCDC worked with states and partners to establish walk-in sites for sample collection, increase communications around testing, and activate at least one testing laboratory in every state and the FCT. Well, joining us in the studio, Dr. Jonathan Dangana, a public health scientist, to assess the COVID-19 testing so far. Thank you for joining us on the program.
Thank you for having me.
I'd like to begin. Is there timely access to testing in Nigeria as at now? We know that earlier we had the major challenge of turnaround testing time for testing. And, is that still the case or has anything changed?
I want to comment by saying that it is noteworthy to actually commend government for what she has put in place, looking at where we started from as far as the issue of COVID is concerned, to where we are. So yes, in terms of access to testing, there is a fantastic improvement in that. And then, of course, that means that in every state across the country, there is actually a place that one can walk in and be able to find services being rendered in terms of tests to be done for such a person. But looking at the turnaround time, I will also say, in fact, in my opinion, the turnaround time is even more fantastic than even the access. As it is now, tops when you go into a facility, within at most 24 hours, you will get a response. But in most cases, you actually, within an hour, within 6 hours, you actually will get a result as far as the COVID-19 test is concerned.
Supposed to, but a lot of people still complain that it takes some even 72 hours before they can get a result.
So the truth is that while those are unique experiences of people, you also will have days that you can get overwhelmed. In those centers, sometimes you get overwhelmed. You can see that in terms of how much data that the NCDC turns out on a daily basis. You have some days that the record and the numbers skyrocket. Other days it looks like, oh, we're all fine. There is no problem elsewhere. So, but give or take, there is significant improvement. There's significant improvement.
So if we look at perhaps maybe a year ago, this period, the 21st to the 27th of December, we had tested about 937 million, I mean, almost a million, 937,037 samples. And looking at now, you know, this is also about that week in December, but a little over a year because COVID was registered in February of last year. We're looking at a figure at about 3.8 million. Would you say this is significant progress? And this is also seeing how COVID has come from last year to the way where it is now.
So you see, very, very interesting. Thank you. That question is mind-boggling. So looking at the time frame within a year, quantitatively, that is in terms of numbers, if you're going to count 1, 2, 3, you will say we have done fantastic well. We've done very well. But hey, come to think about it, in a country of where you are having a population of over 100 million people, and you're only talking about 3 million people being tested, that tells you that there is a lot that needs, or there is a lot that hasn't been done. Okay, so quantitatively, in terms of number, you will say you hear 3 million. In fact, 3 million is not even up to the population of a state. So that is, you can actually even say that within a year, we still haven't been able to test a state in Nigeria, given the numbers and the statistics that we have put in place. But again, there are so many factors that are responsible for that. But I think we're better off from where we started from. But we can do much more.
So looking to the future, and this is also as the world is fighting COVID-19, Omicron, and who knows what variants might be waiting in the future, what should the federal government and its agencies be doing?
You know, sometimes it's difficult when you want to speak in favor of government. But in clear terms, government needs to scale up her responsibility. And what do I mean by that? In my opinion, this is time to have all hands on deck. Every facet of government entity, be it the academia, be it the private sector, each individual or each entity has a role to play in changing this narrative. Because not every citizen finds his way or finds his footsteps around the coffers of government. So each sector where you have the population carrying out her day-to-day activity, there ought to be a strategy as to how each of the citizens needs to be addressed or how they can be reached. In my opinion, I think that there is more that we can do that we aren't doing. I also think that we should and must be able to have all hands on deck. And what I mean by that, all hands on deck, nobody should be left behind. Everybody's idea at this point in time is important. But we need to synthesize those ideas to see which one becomes viable. Because in each phase of the country, there are specific cultural diversity. So you cannot have one fit all an approach. Okay, so what may work for us in Lagos may fundamentally not work for somebody who is far off in Sokoto or somebody who is far off in Nabia.
Indeed. We appreciate your time. Thank you for joining us.
So
still a holiday for a lot of people.
Exactly.
Dr. Jonathan Dangana, a public health scientist, many thanks for joining us.
Thank you so much. Have a nice holiday.
To you as well. And over to Ekiti State, where it's an ongoing process to strengthen the COVID-19 sensitization campaign, this time involving those who survived the coronavirus disease. They shared their experiences with much gratitude to God for scaling the hurdle. Our correspondent, Babajide Agbeyo, reports.
Some survivors of COVID-19 have been encouraging residents of Ekiti State to ensure they are vaccinated and continue to adhere to all prescribed protocols. They joined the team of the State Ministry of Health to move across streets in the state capital, letting people know more about the pandemic. The State Ministry of Health believes steps like these will go a long way in convincing people about the reality of the pandemic and the need to always keep safe. Babajide Agbeyo for COVID-19 update.
Well, still to come, WHO says Omicron risk is very high as Europe faces COVID surge. Please join us again. Welcome back. The World Health Organization says the risk posed by the Omicron variant is still very high after COVID-19 case numbers shot up by 11% globally last week. Omicron is behind the rapid virus spikes in many countries, including those where it has already overtaken the previously dominant Delta variant. The WHO says in its COVID-19 weekly epidemiological updates that consistent evidence shows that the Omicron variant has a growth advantage over the Delta variant, with a doubling time of 2 to 3 days, and rapid increase in the incidence of cases is seen in a number of countries. Kenyans will be barred from bars, restaurants and public transport from the 21st December if they are not fully vaccinated against COVID-19. The measures are aimed at increasing the rate of vaccinations ahead of the festive season. Less than 10% of the population is currently vaccinated, about 6.4 million people. Well, it's well over that deadline, and Dr. Lucky Mwange, a general practitioner, joins us for more from Nairobi. Welcome to the program.
Okay, thank you for having me.
And thanks again for joining us. How are you feeling this period, especially having caught COVID-19?
I'm feeling good, actually. This new variant is very annoying. It's not as lethal as the other variants that we've been having. Mostly muscle aches, lower back pains, but we are not seeing much of breathing difficulties. So it's not been a bad experience as the other variant was. But yeah, I'm feeling well. I can't complain.
So you've not had to be hospitalized due to this variant. Also, if you could share with us how you think you might have contacted the Omicron variant.
Oh, definitely I contacted it in hospital because last week, but one, we've had this really high surges in COVID. We are speaking about more than 30% positivity rate. So I happen to be in a facility where only one in 5 patients, let me phrase this as 4 out of 5 patients presented with the same complaints: sore throat, back pains, muscle aches. So it was really high. That's where I think I got it from, because, as a doctor, you have to examine the mouth, you have to examine the tonsils, you have to do this close examination. That's where I'm sure I got it from. There was no way I could have escaped that. With such a high complaint rate of Omicron, which I'm sure was affecting these patients, there was no way I would have escaped it.
And also, this is inclusive of being vaccinated, the complete dose, and perhaps a booster shot as well.
I had not gotten a booster shot, but I am fully vaccinated. 2 AstraZeneca shots, and yes, most I've also encountered people who have also gotten this from, like myself, 2 fully vaccinated individuals, but I've not encountered anyone who has gotten a booster shot and is complaining of the same symptoms, although I wouldn't expect it, since we are now being encouraged to get booster shots currently. So that will have to be someone from abroad, maybe, who got it. But locally, no one with a booster shot has complained of it.
So we know the AstraZeneca vaccines is most commonly used vaccine in Kenya, and the 2 doses required to be fully vaccinated are supposed to be given at least 6 weeks apart. So in terms of the numbers now, how many people have been fully vaccinated in the country?
We're talking about, in the adult population. I'll base it on the adult population, since for the pediatric population, now that's when we are being told to vaccinate those above the age of 15. So for the adult population, we're talking about around 14.5%. This is data from the Ministry of Health website. So 14.5% of adults have been fully vaccinated. So we're talking about a total first dose of around 5 million individuals, with a total fully vaccinated adults, we're talking about 3.9 million. We're talking about 9 million adults who've been vaccinated. These are people who've received at least one dose. So 9 million, the first dose, 3 million fully vaccinated. We're talking about 5 million who've received the first dose. So in terms of the fully vaccinated individuals, we're talking about 3.9 million adults. That's about 14.5% of the adult population.
And Kenya's total population is about 50 million. But if we look at, the concerns that some African countries have, shortage of vaccines, the Kenyan government says it's confident that it has enough for its inoculation. What other campaigns is the government embarking on to stem the spread of COVID-19, especially with the Omicron variant?
When it comes to stopping the spread of this vaccine, we are dealing with main pillars such as this is the quarantine for those who have it. We're talking about social distancing to reduce the spread. Also the issue of vaccinations. Now, when it comes to the first two, there is not really much control you can have because you cannot ensure the quarantine of a third of the population. That's something you cannot do. You can also not ensure that everyone is social distancing. That's a personal responsibility. But when it comes now to this issue of vaccination, that's where we are seeing a push and pull, where now we are having things like now vaccine mandates being given, where now things like malls, I've actually seen malls which have started denying people who aren't vaccinated, malls like the Junction Mall, to quote it, we've seen it, and various malls are doing it. Churches were also asked to do that, but they declined. So I would say that's the main initiative that's currently being conducted, trying to enforce a vaccine mandate to ensure that those Kenyans who require these services actually go and get vaccinated so that they can get these services. Yeah, so I think that's the main current initiative.
Let's come back to perhaps some of your symptoms. And this is, drawing the comparison between the variant, Delta variant, with what some of your patients have experienced and your experience, your symptoms for the Omicron variant. Are there any, what's the difference?
Okay, I would say I'm fortunate or unfortunate enough to have suffered COVID twice. So I got the first variant in 2020 November. That was when I was in a pediatric rotation. So for these other variants, you are having respiratory symptoms. So mostly cough. We were not having muscle aches and joint aches. That wasn't really prevalent. That wasn't really a very high presenting symptom by the patients. So most patients were presenting with respiratory symptoms. Now with the Omicron, most of the patients are actually complaining of, it has the same sequence for most of them. They tell you they start with a sore throat, then after around 24 hours, they start developing muscle aches. So the most common areas reported by the patients and also for myself was your shoulders are aching, and surprisingly also the gluteal region. This is the buttock regions aching as well. Then we're also having back pains. So we're having lower back pains, we're having upper back pains, and then just generalized body malaise. And malaise is the fatigue and feeling tired throughout, and the muscle aches. Actually, to a point where people were actually complaining that when someone tried to tap them, tapping someone, they feel pain at the region of tapping. So I would say that's the main difference that I've noted. Omicron presents mostly as annoying symptoms which are really annoying, not like the other. Okay, for me, that's what I call them, because these presentations are actually, most of the patients came because they were actually pissed off by the symptoms. Why am I having back pains? Yes, things like that.
Quite annoying, but we appreciate your time. Thank you so much for joining us to talk about this. Dr. Lucky Mwange, a general practitioner, joining us from Nairobi, and do get well soonest.
Thank you. Thank you for having me.
Thank you very much. Nearly 800 Omicron cases have been reported in India's daily COVID-19 infections, a 44% spike from the previous day. Here's more on the global update.
India's health ministry data shows that the country reported 9,195 new coronavirus cases in the last 24 hours, one of the highest one-day tallies in the last 80 days. The data shows that 302 deaths have been reported in the last 24 hours, bringing the total death toll to 480,592. While more than half of India's adult population is fully vaccinated, hundreds of millions are still at risk. Doctors warn that if an Omicron-fueled third wave of infections hits the country, medical facilities could be overrun very quickly. China's COVID-19 vaccines have bolstered Nicaragua's voluntary vaccination program, with local residents expressing strong faith in their safety and effectiveness. At local COVID-19 vaccination sites, people of all ages can get vaccinated for free as long as they hold a valid ID and no appointment is required.
Visit our website. It's channelstv.com for more updates and a better understanding of the pandemic. Plus, you can find other stories at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.